How to inject Wegovy. So what you need is a sharps box, a needle, and Wegovy, of course. For the purposes of this video, I'm just using the 1 milligram Wegovy today, but please follow the directions of your health provider. So what you do first is to wash your hands with either alcohol gel or soap and water. Take the Wegovy out of the fridge, take the cap off, and then to place your needle on the pen, what you do is peel the foil off first. And with the needle, you don't need to jam it on the top. All you need to do is slide it gently on and then twist it on. And then twist it until you can't twist it anymore. Take the big cap off, and this tends to fool a lot of people. Remember to take the inner cap off so that you see an actual needle. When you first use Wegovy, you need to prime it. You need to tell the pen that you're ready to use it, and it also gets rid of any air bubbles that are sitting at the top. So what you do is you twist the dose selector, which is this guy here, and you go from 0 to a couple of clicks where you see a line with a couple of dots, which is to indicate the needle and dots. You then turn it upwards, and then you just press the dose selector bottom, and that primes the line, and you should see a little drop on the edge of the needle. And that's it once. You only need to do that once only. Now, when you want to dial up the dose that you've been prescribed, all you do is dial from 0, and you just keep twisting until you see the dose that you have been prescribed. So for this pen, it's 1 milligram, so I'm going to see the 1. Now you're ready to do the injection. So with the injection, you need to hold it comfortably in your hand like this so that you have your thumb on the dose selector. Pick anywhere on your tummy, anywhere you like, as long as it's away from your belly button. When you do the injection, you need to make sure that you go in at a 90-degree angle to your abdomen because the needle is very short. If you do it in a funny angle, it won't go in the right spot. You can also pinch the skin if you wanted to, but again, you don't actually have to. You can just go straight in. So once you find your spot and you're happy where it is and the needle's fully into the skin, then that's when you press the dose selector. And you keep pressing until it stops clicking like you can hear in my video. Once you've done that, you count to 10 because if you inject and pull the needle out too quickly, you'll actually pull the medication out with it. So you inject, count to 10, and then take it out. Now you need to dispose of the needle because the needle is one use only. The easiest way is to grab that outer cap, place it back on top, and then just twist it off, and it goes straight into the sharps box. Pop the cap back on, and that goes into the fridge for the following week.